And welcome back. I'm Mabel, Jong. Thanks so much for joining us. You're watching WHCC TV, coming to you live from Washington, D.C. We are here in the studio right now with Managing Director of U.S. Markets at Ryalto, who's going to talk about why nurses who are on the front lines very often, but rarely have the decision-making role in many situations. Thank you so much for joining us, Rebecca Love.
Thank you so much for having me, Mabel.
Well, tell me first what Ryalto is.
So Ryalto is a communication engagement shift optimization platform largely for healthcare institutions to better engage their staff and drive KPIs that are important to hospitals.
Okay, that was a mouthful, a real mouthful. And what does that have to do with the work that you're doing on behalf of nurses, for nurses, and that whole sector of healthcare?
I think in healthcare today, healthcare is very disorganized. It's very segmented. We have a lot of hierarchical structures where the top has a hard time commuting with the front line. And the truth is, until we have better communication and engagement with the front lines, how are we going to drive a change in culture that's going to be able to deliver a transformation in healthcare? So Ryalto was based on that entire premise, that it was a communication platform that better drove engagement with frontline staff so that you can determine the culture, the behavior, and the outcomes that you would like to see within your institutions. And for me as a nurse, it was very important that there became pathways where people that were in the decision-making positions actually heard from the frontline staff. So it became very important to me as everything transformed into joining with Ryalto.
Okay, so how and why would a path be different if you had a nurse really in the process of the decision making?
Absolutely. So nurses are the end use of nearly every medical product on the market. There are 4 million of them in the United States, 19 million nurses worldwide. They are the largest workforce in healthcare today. However, nurses, due to hierarchical structures, have always been left out of pretty much the decision-making rooms in healthcare, largely because nurses practice underneath physicians. Physicians therefore report to the chief administrators within hospitals, and that pathway of being able to bring your nurses into those conversations just was something that has not been routinely done. Now, in healthcare, and I think in technology and business, we know that the value ends with the end user. And because nurses are often that end user, when you're developing products, bringing new processes in, bringing products into hospital settings, but never engage the nurse, you actually create more work and more inefficiency in healthcare because you did not engage them.
Okay, so how can we change that paradigm?
Yeah, so there's going to be a need to change to bring nurses to the front line by basically creating places and spaces that are safe for nurses to be able to innovate and also give their feedback, create pathways so that they can actually tell to both the companies and also to their administrators, here's the technologies that are working well for us and here's the things that are not working well for us. There's anything from innovation events to also just simple processes by allowing nurses to report where the inefficiencies and the workarounds are occurring so that those issues can be addressed and also be heard by the front line as well as the administrator and the executive.
And you believe that nurses are natural innovators.
Absolutely. So I honestly believe that it was the innovation of nursing that pulled medicine out of the dark eras of medical practice. It was with the innovation that Florence Nightingale started by basically saying that washing one's hand and sterilizing medical equipment was absolutely necessary to stop the spread of infection across patient to patient. At that time, physicians largely believed that germs did not exist, that what you could not see was simply a figment of imagination, and therefore her ability to prove this fact fundamentally changed forward science, healthcare, and medicine ever going forward with the creation of innovation in nursing. So what's happened since, though, is nurses have been taken out of that position by which they were recognizing things on the front line. And the truth is nurses every day are innovating at the bedside. So on average, nurses are doing 27 workarounds per shift, which means that the equipment that they're handling is actually creating more work for them. So they're creating shortcuts to actually circumvent the system. Unlike places like Google or Amazon, where workarounds are considered and recognized for innovation because they're helping the end user, nurses keep these hidden because in nursing, we're supposed to follow protocol so that we keep patients live. But what we're finding is there's this disconnect between protocol and really what's happening on the front lines so that we can actually be able to rectify these problems and create new solutions that drives efficiencies.
So are we seeing a change? Are we seeing more physicians, if you will, buy into this, that we need to see more nurses in the decision-making process?
I think if physicians understand this and they become one of our biggest supporters, they know that the 23 hours a day they're not by the bedside, it's a nurse that's caring for that patient. But I also think we're seeing changes within hospital systems. Just this last week, Massachusetts General Hospital appointed the first director of innovation for nursing and patient care services in the history of its institution. We're seeing similar positions for directors of innovation in nursing pop up around the country in ways that did not exist 5 years ago. This is a transformative time to deal with nursing because the truth is that similar similar ways that if you're not innovating, our profession is at serious risk of actually fading away because we're seeing challenges coming down the pipeline.
Well, which brings us to my next question. We're seeing a shortage of nurses. First, tell me why, and if we're going to see a sea change if we get more information out about their role changing.
Absolutely. So currently looking at a 1.25 million nursing shortage somewhere between the year 2020 and 2025 within the United States. And the reason that's happening is because we are seeing up to 57% of our new nursing graduates leaving the bedside within 2 years of practice. The largest exodus of any profession in the world. Now, why are 57% of our new nursing graduates leaving the bedside? We graduate 250,000 nurses a year. Why are 125,000 of them gone in 2 years? The truth is it's because the situation in healthcare has largely been broken for nursing. We have failed to involve them in creating solutions. We've failed to create pathways in which they can grow their career, that they can look at healthcare and say, as a nurse, I am able to make an impact that's going to drive widespread change. If we can change the culture in which there are pathways, we allow nurses to come forward with ideas to drive solutions, make an impact, we're actually finding that nurses become excited about this, and that the best will now go into healthcare and go and choose nursing if they want to transform healthcare, because they're going to say, if I want to make changes in healthcare, the best place for me to be is to be a nurse so that I can be with the patient and see what are the major challenges existing on a day-to-day basis, patient-to-patient basis, in which we can create solutions that are going to drive this lasting change.
Okay, and are you encouraged by what we're seeing right now?
You know, I can't believe this. Like 5 years ago, there was absolutely no discussion of this. There was no topic, very few, less than a handful of articles that mentioned nurse, innovator, and entrepreneur in the same sentence. 5 years later, after we started the first innovation entrepreneurship program in nursing, we saw the American Nurses Association appoint the first vice president of innovation at the 125-year-old institution. Johnson & Johnson pivoted the 15-year campaign of thanking nurses to now recognizing nursing across the spectrum as innovators of healthcare. I think we've started a movement. The question is, can we embrace this so that this doesn't become a fad in which many of our early people would say to us, this is simply a fad, to actually be ingrained within our culture. And the conversation needs to keep going. There's a Future of Nursing campaign. Currently in the Future of Nursing campaign that's been designed for 2030, mentions nothing about nurse innovation or entrepreneurship or giving business strategy operation skills to nurses. That fundamental conversation has to be taken place at the highest levels here in DC so that this trickles down across every aspect, educational institution that we face today in nursing.
And why bring that message to the World Healthcare Congress?
World Healthcare Congress is one of the first organizations that welcome nurses onto the same stage as executives from around the world in all avenues of healthcare. This was the first time that I have presented or come to a conference where they recognize the value of the nurse equal to the CEO of hospitals and put them on the same stage. This is a transformative time because World Healthcare Congress reaches one of the largest, most influential populations in healthcare today. And when they recognize the value, the intelligence, the knowledge, and they're going to recognize that nurses perhaps have been the missing piece to transform healthcare today. The leaders here, listening to nurses, I believe is going to be a transformative moment in history of healthcare. And World Healthcare Conference will go down being recognized as the first conference in healthcare to include nurses on the same stage with the same value as their opinions, knowledge, and expertise to transform the future.
Rebecca Love, your energy is infectious. Thank you.
Thank you so much,
Mabel. Your
Mabel.
message is strong. Thank you so much.
Thank you.
And I'm Mabel Jong. We'll leave it there for now. Stay tuned.